Hi all, this is your Endless Nurses World. Today we are going to see about cardiovascular system questions. Cardiovascular means you have to study about the heart and the vessels. Now coming to the questions. A client is admitted to the emergency department with chest pain that is consistent with myocardial infarction based on elevated troponin levels. Heart sounds are normal and vital signs are noted in the client's chart. That indicates vital signs indicates hypotension. The nurse should alert the healthcare provider because these changes are most consistent with which complication. In that questions what they are telling means elevated troponin levels and the patient is having chest pain and hypotension. So we have to first notify the cardiogenic shock. Cardiogenic shock occurs with severe damage. It means that more than 40% of the left ventricle damage. What is the signs of cardiogenic shock? It include hypotension, rapid pulse rate the pulse becomes weaker and decreased urinary output, and the skins are become cool clammy skin. This is the signs of cardiogenic shock. And respiratory rate increases as the body develops metabolic acidosis and shock. So this is the symptoms of cardiogenic shock. So in case of cardiac tamponade happen means accompanied by muffled heart sounds. The patient is having a muffled heart sounds and the neck vessels are prominent. In case of the client's pictures indicates cardiac tamponade. In pulmonary embolism, it means the client is having dyspnea, severe dyspnea accompanying with chest pain. In dissecting thoracic aortic aneurysm, the client is having back pain. So the answer is cardiogenic shock. A client admitted to the hospital with chest pain and a history of type 2 diabetes mellitus is scheduled for cardiac catheterization. Which medication would need to be withheld for 24 hours before the surgery procedure and for 48 hours after the procedure? If cardiac catheterization, it is the procedure to assess the patency of the cardiac blood vessels. So in that procedure, they have to administer the contrast. So in case of the patient is on diabetic patient is taking tablet metformin. So the metformin will interact with that contrast medium. It will affect the renal function and will end up with the patient is going lactic acidosis. So metformin is the answer for this questions. Next question. A client has sinus bradycardia with a heart rate of 45 beats per minute. Complains of dizziness and has a blood pressure of 80 to 60 mmHg. It means hypotension. Which prescription should the nurse anticipate will be prescribed? The patient is having sinus, heart rate and dizziness and blood pressure. So if the patient is having sinus bradycardia, it means the heart rate is less than 60 beats per minute. So this patient is showing the symptomatic, and the hypertension and dizziness it occurs due to decreased cardiac output. So this condition, these patients need an transcutaneous pacing to provide temporary measure to increase heart rate and thus perfusion in the symptomatic client. So the administered oxygen deduction will further decreases the heart rate and defibrillate the client. It is not indicated. It is indicated for ventricular tachycardia and ventricular fibrillation. And monitor the client. It is not a necessary intervention. So the answer is prepare for transcutaneous pacing. The next question is the nurse is in a medical unit is caring for a client with heart failure. The client suddenly develops extreme dyspnea, tachycardia and lung crackles and the nurse expects pulmonary edema. So the nurse immediately asks another nurse to contact the healthcare provider and prepares to implement which priority interventions. Select all that apply. So the question is asking pulmonary embolism. So pulmonary edema. So what is the clinical pictures of pulmonary edema? So pulmonary edema, it is a life-threatening event that can result from severe heart failure. What will happen? The left ventricle fails to eject sufficient blood and pressure increases in the lungs. So because of this accumulated blood, the patient is having pulmonary edema. So in that conditions, the oxygen supply is also reduced. So the client is needed oxygen and the client is placed in a high Fowler's position and for easy work of breathing, and we have to administer furosemide. Furosemide, it is a rapid acting diuretic and it will eliminate the accumulated fluid, and we have to administer morphine intravenously. What is the functions of morphine? What will happen? When we are administering the morphine, it reduces the venous return. It means preload and decreases the anxiety and also reduces the work of breathing. And if the patient is having pulmonary edema, we have to inserting a Foley's catheter. The other options is not indicated because the transporting the client to the coronary care unit not needed, and patient in a low Fowler's position, it is not indicated. So if the client is having pulmonary edema, we have to administering the oxygen, inserting a Foley catheter, administering furosemide, administering morphine sulfate intravenously. Then next, a client with myocardial infarction suddenly becomes tachycardia, shows signs of air hunger and begins coughing, frothy, pink-tinged sputum, which finding would be nurse anticipate when auscultating the client's breath sounds. So the clinical symptoms are tachycardia, air hunger, and the coughing, frothy, pink-tinged sputum. So it means the patient is having pulmonary edema. So pulmonary symptoms, edema symptoms is extreme breathlessness, dyspnea, air hunger, and the production of frothy pink-tinged sputum, and the lungs auscultation, it indicates the crackles. So these are all the symptoms indicates pulmonary edema. And the stridor, it will due to the laryngeal edema, laryngospasm in the upper airway. Then bronchi and diminished breath sounds is not a associated pulmonary edema conditions. So answer is crackles. A client with a myocardial infarction is developing cardiogenic shock. Because of the risk of myocardial ischemia, what condition should the nurse carefully assess the client for? Patient is having myocardial infarction and she is developing cardiogenic shock. So what will happen? So what is the classical signs of cardiogenic shock? So the cardiogenic shock occurs, it's due to the myocardial ischemia. It includes low blood pressure and tachycardia, and central venous pressure, it also increases because of the due to backward effects of severe left ventricular failure. So in cardiogenic shock, the patients will develop ventricular dysrhythmias. It is due to decreased oxygenation and severe damage to the left ventricle. It is more than 40%. So the answer is ventricular dysrhythmias. A client who had cardiac surgery 24 hours ago and has a urine output averaging 20 ml per hour for 2 hours. The client received a single bolus of 500 ml of intravenous fluid. Urine output for the subsequent hour was 25 ml. Daily laboratory reports indicates that the blood urea nitrogen is 45 mg per deciliter and the serum creatinine level is 2.2 mg per deciliter. On the basis of these findings, the nurse would anticipate that the client is at risk for which problem? The patient is having the cardiac surgery 24 hours ago. The symptoms are decreased urine output and increased blood urea nitrogen and increased creatinine level. So the normal blood urea nitrogen is 10 to 20 mg per deciliter and the normal creatinine level is 0.6 to 1.2 mg per deciliter. So these occurs, it's due to acute kidney injuries. So during cardiac surgery, what will happen, because some of the reasons patients will develop acute kidney injury. It is due to the poor perfusion, hemolysis, low cardiac output, or vasopressor medications therapy. So in acute kidney injuries, these three signs indicates acute kidney injuries with the patient will need hemodialysis or peritoneal dialysis. The answer is acute kidney injury. The nurse is reviewing an electrocardiogram rhythm strip. The P waves and QRS complexes are regular. The PR interval is 0.16 seconds and the QRS complex is measured 0.06 seconds. The overall heart rate is 64 beats per minute. Which action should the nurse take? So first we have to see the electrocardiogram. In that P wave present, QRS complex is present. So the normal PR interval is between 0.1 to 0.20 seconds. The normal QRS measuring about between 0.04 to 0.10 seconds. So there are no irregularities in the rhythm. It means it's normal ECG. So we have to continue to monitor for any rhythm changes. This is the answer. So checking vital signs and laboratory test results and notify the healthcare provider, it is not necessary. The patient is on normal rhythmic pattern, so we have to monitor any rhythmic changes. A client is wearing continuous cardiac monitor which begins to sound its alarm. The nurse sees no electrocardiographic complexes on the screen, which is a priority nursing action. So patient is under cardiac monitor, so there is missed cardiac beats. So we have to assess the client status and lead placement. So sudden loss of electrocardiographic complexes indicates when the patient is on ventricular asystole or possibly electrode displacement. So first is we have to assess the client status and the monitor apparatus. Then after that only you can call a code, then call the healthcare provider and press the recorder button, everything that is secondary. So answer is check the client status and lead placement. The nurse is watching the cardiac monitor and notices that the rhythm suddenly changes. There are no P waves, the QRS complexes are wide and the ventricular rate is regular but more than 140 beats per minute. So the nurse determines that the client is experiencing which dysrhythmias. The ventricular tachycardia. What in question they know P waves, the QRS complex is wide and the ventricular rate is, it means tachycardia 140 beats per minute but rhythm is regular. In sinus tachycardia, P wave is present and ventricular fibrillation, no QRS complex is present. Premature ventricular contractions and the ECG shows the ectopic beats, rhythm will occur. So the answer is ventricular tachycardia. So ventricular tachycardia, it means the absence of P waves and QRS wide and QRS complexes, it means the more than 0.12 seconds and a rate between 140 to 180 beats per minute. So answer is ventricular tachycardia. Next question. A client has frequent bursts of ventricular tachycardia on the cardiac monitor. What should the nurse be most concerned about with this dysrhythmias? So the patient is having ventricular tachycardia in a frequent burst. So we have to first, because ventricular tachycardia, it is a life-threatening conditions. So what will happen? It is due to the irritable ectopic focus that takes over as the pacemaker for the heart. So the low cardiac output results can lead quickly to decreased blood supply to the cerebral and the myocardial. It will cause myocardial and cerebral ischemia. So because of that, the patients will develop impending doom. And ventricular tachycardia, it's mainly treated with anti-dysrhythmic medications and cardioversion. If the patient is conscious, so we have to do cardioversion, and defibrillation if the patient is unconscious. So these are the measures to apply and to revert the ventricular tachycardia, because the ventricular tachycardia fibrillation will end up with ventricular fibrillation. So because it is a life threatening condition, so the answer is it can develop into ventricular fibrillation at any time. These are about cardiovascular questions. If you have if you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.